Now, one of the things we also talked about was don't put Q-tips in your ear.
Absolutely. Q-tips are something that should not go into your ear. I had an ENT one time tell me you shouldn't put anything smaller than your elbow into your ear. And it's really a safety issue. Q-tips, while we think and we may look at the end of a Q-tip after we take it out, we may see that there may be some wax or debris on it. You really did not get the wax out. You probably packed more wax down into your ear than you actually did helping get wax out. So the Q-tip actually acts against you instead of working for you.
Okay. Now, I remember I must have been about 10 or 11 years old, went to the doctor, and he took an ear spoon, went into my ear, and pulled out a little piece of wax. So is that, people still do that, or do you take the syringe with the warm water and you shoot it in your ear?
Certainly. Well, different medical clinics, different physicians will use different methods to remove earwax. Some of them still use an irrigation method. Some of them use a type of a curette, which is like a little spoon that they use. But I recommend you letting a physician do that in a physician's office, not something that you would do at home by yourself.
Okay. All right. Well, that's good. That's good. That's good to know. Because you go do that, and the next thing you're like, hey, what did you say?
That's right. That's right.
In terms of age, when should an individual, especially when they get over 60, start to have regular ear exams?
Oh, that's a wonderful question. Hearing loss can affect anybody at any age. Okay, it knows no age limit. But if we are looking strictly at someone that has had some sort of age-related change and it's just gradually changing, once you get around that 60 to 65 mark, it's really ideal to get your hearing tested about once a year.
Okay.
Get a baseline established. So that way you can begin to track and determine if you have some type of hearing loss or hearing impairment, or if you do not. And in most cases, insurance does cover an annual exam each year at no cost to that patient. So there's usually a zero copay to get your hearing tested once a year. Now, each insurance may be a little different, but as a general rule, most of them will cover a hearing exam once a year.
I remember from grammar school that they would come out and bring a hearing van or something and would test the students' hearing. Does that still go on, or is it more or less in shop going to somebody's office?
Certainly. So yeah, typically through school ages that does still go on. I do some contracting work with Head Start programs through a company, and I go out and will help do some of the hearing screenings, but those are on younger kids in elementary school type ages.
Okay.
But then also it's good. Most schools do have some sort of policy where they check every few years children's hearing in school.
All right.